Good morning. B. Hawkins here with Let's Talk Healthcare. And what I want to do is kind of set the stage for what you can expect to come to you on this channel. What I will bring to you is information and education based on the last 20 years of my experience in healthcare. So the content that I will bring you is not going to come from just a book that I read or something that a friend told me or something that I may think I know. Before I bring you content, it will be based on actual experience. It will be based on factual information and different scenarios that I've actually been placed in. A lot of the content that I'll bring you, I will tell you, you're not going to be able to get from a book. Because a lot of times people that write books or they place articles on the internet, they tell you what they want you to know or what they think they know. And a lot of times they haven't even been put in the situations that they're discussing. So I'll give you a little bit about myself, try not to bore you too much. But I started in healthcare in 2003 as a nurse aide in a skilled nursing facility. And from there, I added my med tech certification onto that. So I was working both of those positions at the same time, along with raising 3 young girls on my own. From there, I actually moved into the world of hospice as a nurse aide. And I was in that field for a little while and gathered some additional knowledge and learned that I really did enjoy being there at the bedside at the end of life for somebody. I then had an offer to move into what some people will call an intake position. Some people call it admissions. Basically, I was the point person to receive referrals for a hospice agency, be able to process those, take all of the steps that needed to be taken in order to get that patient on service to be seen by the care team. It was at that point in my career I was then offered an entry-level position in sales. Now, I'm coming to you from someone who has no college education pertaining to sales. I have no master's, I have no bachelor's. Have I been to college? Yes. And at some point in the content, I will talk about that at a later date, but not today. So I took that entry-level position, which then launched me into the remainder of my career. I not only was a lead salesperson for 3 different companies and broke 3 different sales records, but I was also a regional. I worked with operations quite a bit. And again, I didn't have a structured college education or degree to do this type of work. All of this knowledge came from the School of Hard Knocks, basically. It was me learning. It was self-experience. I was a caregiver for some of my loved ones. And again, that will be content that will come to you or be brought to you in the coming days, along with a nice backdrop, because I did say this is just the introduction. So you'll get to learn a lot more about me, but you'll also get to learn a lot more about what you need to look for. And I thought that it's important that you know who I am, or at least a little bit about who I am, in order to listen to that content and actually utilize me as a resource. Some of the topics that will be brought to you in the coming days are going to range from everything about what you need to look for in senior placement. If you're looking to place your loved one, mom, dad, grandmother, grandfather, even maybe if you have a child, bless your heart, that may end up needing some type of care. The goal is to be able to bring you resources based on the type of facilities that you may need, because every facility is different. Every facility has a different level of care. Every facility accepts a different type of payer. So we're going to deal with that some. And I'm also going to give you the opportunity, I'd like for you to comment if there's a topic that you all need to hear more about, or you need resources and you've looked, people have told you things, you've gotten 2 or 3 different stories, drop a comment and let me know, and I will bring you that content. If I'm able to bring it to you myself, great. If I'm not, I still have an active book of business to where I can pull in different people to be able to bring you that content. And I'll give you some greater details about that in the coming days as well. We'll talk about resources. Again, that's going to go back to not just people I can bring you, but resources from my own experience. And here's the thing, if I don't know, I'm not afraid to tell you I don't know. What I will do is I'll get you the answers, and I'll get you factual information that will help you make the decision that's going to be best for you or your loved one. We're going to discuss Medicaid, what that process looks like, what you need to be aware of. What are the differences between community Medicaid and nursing home Medicaid? Yes, there are two different forms. I have a company that I still refer to that helps with Medicaid filing. I hope to bring you some information from them as well. So we're going to do some details on estate planning. What you need to know when you plan your estate. Do you have a will? Is the will good enough? It's not. Those details will be coming later on in some future content because I can't give you everything right now. It's just too much. There will be some tips and basically some common sense strategies that help make me successful in sales, utilizing my skill sets to get where I am today. I'm an entrepreneur now. Again, that's future content that I plan to bring to you. And so that I know I'm not missing anything. We're going to deal with different diagnoses. I'm not a doctor. I'm not a physical therapist. I'm not a nurse. Again, I bring you experience. So different details on different diagnoses based on what your placement or your care plans may need to look like. There's the possibility of me bringing you some physical discharge planners that are still active in their roles to this channel. And we're talking social workers, registered nurses, people that can really speak from their seat in their area of expertise. And while I worked with these people for over 15 years, no one can give you information or education better than someone who is actively in that role or who has done that role. There's also going to be discussion about what type of plan should you choose, and I mean healthcare plans. So we're talking Medicare, we're talking Advantage plans, what to expect from your HMOs, your PPOs, if you have Medicaid, what you are entitled to and what you are not and why. So again, there's going to be a lot of great content coming to you in the coming days. The goal is going to be to try to put out content at least once a week. Some of it will be self-generated. Most of it is going to come from you. And so I need to know, what do you need to know? If you're struggling with something that's healthcare related, sales related, insurance related, drop it in the comments and hit that subscribe button. And the future videos coming to you will be better planned out. The next one will drop next week. I do not know what that topic is going to entail yet. It may depend on you. And so again, I just wanted to introduce myself, kind of tell you what to expect in the coming days. And I'll give you some more information about me as we go. So welcome to the channel. Again, hit that subscribe button, drop me a comment, and I hope to hear from you and talk to you all soon. Have a great day.